everyone, welcome to Digital Health News and welcome to DHN CXO podcast. Today we have with us Mr. Mandar Kulkarni, National Security Officer at Microsoft India, and we will be talking about confidential computing and the impact of DPDP Act on healthcare providers. Thank you so much, sir. Thank you so much for joining us here on DHN. So, let's just first start. We are talking about confidential computing today, but just to start off the conversation, could you please walk us through your journey in cloud, in IT services and data centers?
Thank you. I am, as you said, National Security Officer for Microsoft India and South Asia. I'm playing this role for now just over a year. With Microsoft for close to 11 years now, right? The journey with Microsoft started when Microsoft decided to set up their own cloud and data centers in India way back in 2014. So my first assignment when I joined Microsoft was our CEO, Satya Nadella, was going to be in India and we are going to make big announcements, so get ready for that. So that has been an exciting journey over now last 11 years. I am in IT industry now with close to 27 years. First 10 years, like most of the my generation IT professionals, was in IT services, worked on remote infrastructure management, went to US, handled some of the large transformation projects. And then 15-16 years primarily in data center. Started with Tata Communication, helped Tata Communication build their data center and managed services offerings. Then NetMagic, which then got acquired with NTT. And since 2014 with Microsoft. Primarily focused on cloud, data center, AI, artificial intelligence, and now on cyber security. I think the two areas which are very, very exciting right now in IT, one, artificial intelligence, where Microsoft is leading the charter, and cyber security, which is becoming more and more front and center for a lot of organizations.
Let's come to confidential computing. We have heard about confidential computing, but it would be really great if you could just walk us through it. What exactly is confidential computing and how does it work?
So I think life has come full circle. Most of us grew up about worrying about data, right? Data at rest, data in transit. The first thing that most of the organization put in place is data encryption for data at rest, right? You use various technologies, whether at storage or at database level, to encrypt your data, which is more or less has been happening for a lot of time. The second thing that started happening again for a long time is data in transit, encryption of data in transit, right? So when you are transferring data within your data center or across data center, across your client server, you encrypt that using various protocols. Both have been mainstream for a long time. What was missing was encryption of data when it is being processed, right? So in 2014, Microsoft Research started focus group called Confidential Computing. Then 2019, we co-founded Confidential Computing Consortium, industry group of people organizations who would basically develop the confidential computing standard. And I think acceleration we are seeing from 2020 to 2023, when the chip makers started building chips, which then support confidential computing. Intel, AMD, NVIDIA, all of them now have chips which actually support confidential computing. So what is confidential computing, right? As I said, when you have data encrypted at rest in transit, right, you take care of 2 out of the 3 requirements. But ultimately, when you are processing the data, you have to unencrypt it. You have to decrypt the data, you have to process it, right? And that's when it is vulnerable, right? With virtualization, with cloud, most of the data processing happens either inside a virtual machine or a virtualized environment, could be a container. It can happen in your own data center, it can happen in third party, it can happen on cloud. But when your data is decrypted, you essentially are exposing that data to threat act, somebody who could breach a hypervisor, somebody who could gain access to your computing environment. How do you protect against that? But that's where the confidential comes into picture. What it does is it creates a trusted execution environment, what is called as TEE, right? And that is done through hardware-based, what we call as enclaves. So those enclaves essentially create a trusted execution environment where only the trusted code can come in. So you have to attest that code, so only that code can come in that trusted execution environment, and that's where you decrypt your data. So that decryption of the data happens only in TE and only the trusted programs, applications have access to TEE. That way you are ensuring that your data is available to only attested applications. And you tighten the TE, right? You don't bring everything in the TE. You bring only the applications that you trust, only those who are attested, they have access to your confidential data. And since it is rooted in hardware, you are protected against any compromise that can happen at hypervisor level or at any other level. The other thing that it brings in is zero trust. You are no longer trusting hypervisor. You are no longer trusting your administrator or cloud administrators. One of the big questions that most of the cloud service providers struggle with when they are dealing with confidential data, whether it is health data, whether it is national security data, whether it is government data or financial services data, is that when we bring data onto your cloud, we agree that it is kept at rest in encrypted, in transit it is encrypted. We essentially are trusting you, cloud service provider. By keeping that data in the trusted execution environment, TEE, which is rooted in hardware, what we are telling the organization is that you are no longer trusting even the cloud service providers. You are creating a TEE which only you decrypt your data, as well as you attest application which have access to it. So the dependence on a hypervisor and layers below that is gone. Now that's a game changer in encryption.
You mentioned about healthcare data, and we have all heard people talking about how data is the new oil, but healthcare data, I believe, is the gold mine of all the datas, and it also leaves patients to vulnerable to threat actors who are taking advantage of such situations. We have seen last year there have been multiple healthcare data breaches across countries. Change Healthcare in the US being the primary example. I would like to ask you, in Microsoft, how are you envisioning the clinical collaboration? Because healthcare data flows between multiple departments. How are you envisioning, the clinical collaboration with confidential computing, especially in a federated environment like diagnostic AI?
I think this is a very, very exciting field, and at the same time, something that requires additional innovation like confidential computing, right? There are 2 or 3 very, very important scenarios that come into picture. Number one, world is moving at a fast pace toward bigger adoption of artificial intelligence, right? Healthcare has been using machine learning and many of the artificial intelligence innovations for quite some time. And that will accelerate thanks to the innovations that happened over last couple of years in AI. So that's number one. And all AI is rooted in data. The more and the cleaner and the better data that you have and diverse data that you have, your AI algorithms are going to be that much better. So number one is, across healthcare industry, there is a dire need of pulling data together so that better models can be built. So that's number one. Number two, the problem that you mentioned, patient health records, right, or the data exchange that needs to happen, so that ultimately the servicing of patient, when they go from one hospital to other, or there are different periods of time when their history needs to be pulled out, right, is done well. Both of these requirements mean you need data collaboration. Why? Because no one hospital chain or pharma or healthcare provider will have all the data that you need. And that happens because of 2 or 3 reasons. Number one, some of them specialize in a certain type of patient, certain type of diseases. Number two, because of geographical diversity, the disease pattern, the patient or the even human factors differ. For your model to be accurate, you need all type of pattern, all type of data to be pulled in. Now, how do you do that? Because this data is, one, sensitive, it's patient data. Second, it's also, as you said, right, data is the new oil. It's also, for lack of better, like property of that healthcare provider. They have spent decades in servicing patients, in building that data sets. They don't want to give that data widely to people because of security concerns, as well as because it is their IP. But if you don't bring data together, you can't get better models. One of the solutions that Microsoft is working on, the confidential computing data clean rooms, essentially multiple healthcare providers can come together and they can bring their data. They don't need to send the data to other providers, right? What they are doing is they are bringing their data to the TE, trusted execution environment, where only a specific program has access to that data. For example, you are now building a new healthcare model. Multiple healthcare providers come, they expose their anonymized data, they export their completely secure data into that environment, which that algorithm use only to train itself. So that data is not shared from organization 1 to organization 2. It's only exposed to the algorithm which uses it to train it. You get a better model for that. The second problem along the same line is when a patient is getting transferred from hospital 1 to hospital 2. If you can create those trusted environments where hospitals exchange patient records and they have full control on what do they want to expose, what data they want to expose, how anonymization they want to do. They do that, and that way a patient health record can get exchanged across organizations. I think that's how confidential computing data clean rooms can actually solve the current challenge that we see in collaboration between two healthcare providers.
As you rightly mentioned, I mean, hospitals are building their own data models now, their own AI models now. And that also needs a lot of collaboration between external departments as well, not only the internal departments. You see, in a connected digital health world, hospitals are also collaborating with pharma companies, with the startups, with health tech startups and innovators from different walks of life. Now, my question is, how do we ensure that the data is secured while the innovation velocity is also not hampered?
We have two fantastic examples. In the US, there is beekeeper.ai, and in India, Apollo Healthcare, right? Both of them are working closely with Microsoft in creating the similar environment. So you have an idea or you have a startup which wants to build models. So first thing they do is they use their own data and they create a rudimentary model. They create then the trusted execution environment where they invite others to share data. Now, if others believe in the confidentiality and integrity of that TAE, then they are open to share the model. Advantage for the other people who bring in data is that they benefit from the same model because it is a model that becomes collaborative. It's a model that then can be shared by multiple healthcare providers. And that's where we are seeing this innovation acceleration happening. I bring my data and in return I get a better model that actually enhances my service is something that is driving this innovation. Because fundamentally, I am actually trusting this environment.
So, healthcare is one of the most heavily regulated areas. And how can confidential computing accelerate the adoption of hybrid cloud models, particularly in context where data localization and residency comes in picture?
Yeah, absolutely. Great question. See, data residency and sovereignty are the needs of today's time, especially in the changed geopolitical situation. We are seeing healthcare is certainly one, but again, in India, Reserve Bank of India mandated data localization some time back, right? So we are seeing financial data to be also being local. We see a lot of our global customers who have business in India actually bringing the data and keeping on our cloud data centers in India. So localization is definitely gathering momentum. But along with localization, there are a couple of other things which are important. If you look at this whole story that is unfolding, I think it's a 4-layer approach, right? At the root of that is data security, right? Wherever your data is, how is it secure? That's where encryption, that's where confidential computing and these technologies come in. So first, your data needs to be secure. Second is compliance. You need to be compliant with local laws. You need to be compliant with global standards. You need to be also compliant with industry standards. For example, in healthcare, there is HIPAA, right? For privacy, there is DPDP in India, GDPR in EU, so and so forth. In health, in BFSI, you have standard like PCI. So second layer is compliance, that you need to be compliant. And that's where you need frameworks, you need automation that can help you apply those templates to your, but the third one requires geographical location where you can deploy those things, right? So you not only bring data in country, but you also apply security and compliance templates to it. And finally, sovereignty. Sovereignty means whether it is the data generating organization, which is like a healthcare provider, or the nation has access and control of the data any and all the time. Now that I need to have sovereign access, sovereign control over that data. Now again, we enable that through what we call as sovereign clouds, and confidential computing is what we use in that as well. This is a 4-layer approach from security all the way up to compliance, residency and sovereignty. And that is again rooted on this technology that we talk about. We live in a world where you generate data across the globe, you process data across the globe. So digital residency, digital sovereignty is extremely important for you to implement. The technology like confidential computing, encryption, essentially allows you to exert that control wherever your data is.
Mr. Kulkarni, we have been talking about digitalization in healthcare, and Indian government has taken steps towards that through initiatives like ABDM. And India is creating a whole digital ecosystem. But that also means there has to be interoperability between the public healthcare institutions and private healthcare institutions. How do you think confidential computing can enable that secure platform for this interoperability?
What we are seeing is a typical model that unfolds. First wave was when healthcare providers became digital. It was easier for the new age providers because they started their processes which were more digital. But even the traditional one, older ones now are almost fully digitized. So the first phase is when healthcare providers become digital. Right? Second is when this need is felt where they need to collaborate on data. And we are seeing that unfolding now. Some of them are taking the first step. Some of them are exchanging that data. Some of them are working with their peers. That is something more P2P. What we have seen happen in other industries that I believe will happen in healthcare as well is one, government will create more collaborative framework. So government might take a first step. Think about a UPI or an Aadhaar kind of infrastructure in healthcare. So a healthcare DPI stack, if I may. So that's one area. Second, industry will come together and create collaborations, right? Now, for whether government creates that collaborative or a DPI in healthcare, or whether industry comes together and create that, for both of them, you will need trusted technology to enable it, right? And that's where confidential computing comes into picture, or even the data clean room comes into picture. The industry to go forward, whether it is patient record exchange, or whether it is collaborative research, you need an environment where free information exchange with confidence can happen. And that's where I think technology like confidential computing are going to make a big impact. It could happen by government centrally creating it. It could happen by leading healthcare providers take that initiative and build a confidential computing environment, data clean rooms where other people can collaborate. It could be a startup. We are enabling that through technology, but there are our partners, there are our customers who are actually taking the initiative. We are also working closely with government to enable that.
Since you mentioned government and DPDP Act, since DPDP Act has come into picture, I think you would also agree to that. In healthcare boardrooms, this topic has become a major point of contention, how to protect the patient data. Now, for a large healthcare institution, what kind of privacy data engineering models would you suggest, considering the fact that DPDP Act has a heavy emphasis on consent and data fiduciary responsibilities?
There are two ways you could look at DPDP adoption. One, you could look at compliance as a necessity, and you could look at how do I take my processes and fit into the DPDP requirement. That would certainly fail. You have to look at privacy engineering. You have to look at your processes end to end. Think about digitalizing those processes and think about doing privacy engineering so that you have right tools and right processes which support DPDP. I think DPDP is a great framework that has come through for multiple reasons. We as individuals care about our data, right? We don't want our data to be available for buying, for malicious use and all that. So DPDPA gives us that as an individual, as a citizen, ability to control our data. That puts onus on the organization to do privacy engineering so that they rethink their processes and they adopt those tools. Because it's not only consent, right? First, you need data discovery. You need to know where all private or personally identified data, PII data is, or in healthcare, PHI is there, right? So first, you need ability to discover where that data is. Second, you need then the ability to control that data. Encrypt it, ensure that there is access control, ensure that it doesn't leave your organization. That's the second step. And the third step then to put a mechanism around consent, around forget me and all that. So you need all these three abilities. Now that can happen when you adopt a tool set which allows you, or platforms which allows you to do all three. Data discovery, control the data, whether it is your data loss prevention and technologies which will allow you to control your data. And third, a whole consent management. Now, we learned this the hard way because we operate globally. Microsoft and we have our productivity platform, our SaaS tools. So when GDPR came way back 2016, 2017 in EU, first we had to develop these tools for our own use, right? Because there is a lot of PII data that comes to Microsoft Cloud. So we had to develop tools which will help us become GDPR compliant. And then we turned around and now these tools are available, whether it is Microsoft Purview, Microsoft Priva, which are now available to customers for helping into their DPDP or even GDPR earlier compliance. So whether you use these tools or use anything else, but healthcare providers will need to rethink their processes, their digital processes, right, in terms of privacy engineering. And they need to adopt the tools which will allow them to do data discovery, control the data, as well as do whole consent management around it.
Absolutely. We have been talking about, confidential computing and protecting the data. But in this process, how do we also ensure that the convenience remains intact?
It's always the balance. The more security you bring in, the more compliance you bring in, sometimes you are going to bring in additional complexity for the end users. There is no easy way of saying it. As you bring in more security, as you bring in more compliance, there will be, if not inconvenience, there will be a change in the working for the end users. You need to adopt that because it is for the greater good. Whether it is for the end users, patients, or even people who handle data, their risk is getting reduced by you being more compliant, by you handling data more securely. So that's how people need to think. It's a bit of education that the organization will have to drive down. Sometimes people take the same process and digitalize it. They don't really rethink the word that you used earlier, privacy engineering, or they don't re-engineer those processes so that they are more digitally native. If you take a physical process which has been working for 20 years and just do digitalization of that, you're not really doing it optimal. So people have to rethink their processes rooted in technology, rooted in tools. Now that would do two things. One, it will make that process much more efficient. But it will also not burden the end users so much, right? Because it's the process and the platform that allows ease of use. So when you digitalize processes, don't just take a process and convert that as it into digital. Think about a tool around which you automate that process. I think that has been the success, right? Whether even you look at the ERP implementations that happened over last 30, 40 years. The most successful ERP implementations have been the ones where an organization adopted the right ERP and then fine-tune their processes to suit the ERP. So don't take a tool and customize it so much to suit your processes. Use this as an opportunity where DPDP adoption or any of the digital transformation that a healthcare provider will go through. Use that as an opportunity to re-engineer your processes. Make them more digital, right? Not only in implementation, but also in thinking. That is the best way to get most out of digitalization.
Mr. Kulkarni, you mentioned about the complexities increasing for the end user whenever we go through the entire privacy engineering model, when we rethink the processes. Now, from the change management perspective, and I know this question comes in the picture for the client side of it, but what would you suggest should be the approach for them?
So I think any change, the first principle of the change is communication. You need to communicate to your end users necessity of change and also how that change will benefit them. You have to get a buy-in from people who will actually implement the change. Many times the importance of a change gets lost and you see people bypassing those change processes because they are not convinced, they are not bought into it. So I think the first thing is communication. That could mean pure communication, that could mean some training for the people. I think that's the first principle. The second, as I said, right, is you make change as easy for the users as possible through really looking at right tools, right platforms that would make it easy. If you stick to the process and just wrap digital around it, it's going to be a lose-lose. The users are not going to be having better experience, will not achieve the objective. If you do these two things right, if you do the communication, skilling, training of your teams right, they are bought into the change that you are bringing in, and you enable them, empower them with the right tools, most of the changes go through. And I again go back to my ERP example. That's where we saw big transformation. I'm talking about a very traditional industry like manufacturing, right? Where people 30, 40 years back question why do they need something like an ERP. But the organizations which were able to convince their teams that this actually enhances your productivity, and they were able to implement it right rather than breaking or molding the ERP to their age-old processes. They adopted, they changed their processes to fit. They really multiplied their gains.
Absolutely. As you rightly mentioned, I think just dumping down the technologies or the changes on the employee may not have the desired result. The communication has to happen from top-down perspective. My last question to you is, what strategic opportunities do you foresee for Indian healthcare providers to become global leaders in privacy-preserving digital health innovation using confidential computing and DPDP as a leverage?
And it is a fantastic question, right? We are almost at the cusp of a breakthrough in this field. Why? We got all the right ingredients. India is acknowledged as a leading healthcare provider, whether it is pharma, whether it is our healthcare. And we do that in India, and a lot of healthcare professionals go out and prove the way IT professionals outside India are celebrated, right? Large organizations, IT organizations. Number two, for the digitalization for digital industry, you need tech that also there in India, right? That's the second part. Third, thanks to DPDP, now we are building a foundation of privacy. Why is that important? That is important for you and me as citizens, as individuals. But it's also built trust to other nations that India now has a privacy safeguard. It is at par with the global standards, or probably better than many of them. So these three things: one, you have fantastic healthcare ecosystem, you have IT ecosystem, and you have now standards, right, which are at par with global standards. The need is the startups and the healthcare providers to come together and not only look at implementing digital solutions for their own DPDPA compliance. It is our opportunity for us to now build platforms which we would be able to export, which we will be able to expose to the global providers, right? If we bring these three things together and build platforms which then can serve global healthcare providers, right? Because you see one or two of these components in many countries. You rarely see all the three components together at same point of time, right? Maybe I add a fourth one, right, which is the startup ecosystem that is building in India. You bring those four components in, you have a recipe for a large, very innovative healthcare platform developed in India, which is not only serving healthcare in its own, but also enabling privacy, enabling innovation. The final point there is also this AI piece that we are talking about. While a lot of interest is there in healthcare AI, the privacy or the data security component of that, right, is something that is getting debated. How much can be done? How much data can be brought together? So if India is able to build platforms which are privacy compliant but allow a secure collaboration of data across healthcare providers, it is something that we can do. We can actually build innovative models, whether it is healthcare models or AI models, right, using the collaborative ecosystem that we can build. That's where I think the need for us to come together, different healthcare providers and technology providers to come together and build this collaborative, confidential computing data cooling environment will make a significant impact.
Absolutely, completely second that. For any kind of change or for any kind of such initiative, I think collaboration is the key, and that collaboration should happen between tech firms, the government, the policymakers, the innovators, and of course the healthcare ecosystem. Thank you so much, sir. Thank you so much for this deep dive conversation. I think I personally learned a lot from this conversation. Thank you so much and all the best.
Thank you, Aradhya.